So let's call our meeting to order. We'll take a look at the minutes, see if anyone who wants to make a motion or has any comments.
I have a comment.
Go ahead.
I would like our minutes to be printed out again, the way they were before, because like Dennis is not gonna read them online. And
I
Does
do.
he read them anyways?
he does when we sit here.
Yeah.
So, there he is.
Yeah, well, let's check with him.
Hey.
Dennis, I'm calling you out already. You just arrived.
I know, I'm not even up the stairs.
Okay, there you go.
I was
Good to
requesting
see
that
you,
our
Dennis.
minutes be printed again because they had stopped printing them, so
Uh-huh.
that you were able to review them during the meeting.
Yeah, I did.
Did you review them?
I reviewed the agenda.
Did you review the minutes also?
No, I did not.
Okay.
Would you like them printed?
Are you able to get the minutes?
Yeah,
You are, so you do have the ability to just.
I have
Okay.
the ability, I just didn't do it.
Would you
Okay.
prefer they print yours?
I'll
You have a
make sure I
copy?
start reading them.
I don't, not with.
Okay.
No, Lori does.
You can look on it, I'll pull them up.
It's my
Oh,
copy.
you got a copy.
Okay, hang on a second.
Okay.
I try to do my due diligence and read it when I see what's on the agenda.
I do also,
Yeah.
but sometimes we don't have the opportunity.
Right, yeah.
Larry, if we were to move on, could you maybe go downstairs and make copies of the minutes and bring them back up? And that'll give everybody a chance to review them before we move towards a motion or anything along those lines.
I think everybody
you
did.
Joe, the
I think
rest of them
everybody has.
read them except for Dennis.
Yeah, and I've just
So-
reviewed.
We're good.
Okay,
We
then
can
fine.
proceed.
We're okay.
It
But
wasn't
in
a
the
long.
future, I agree with
Make a
Heidi. I
motion to
would
accept the
consider-
minutes of February 2 as presented.
Second.
Okay, all in favor?
Aye.
Hi.
I will abstain. I was not present for that meeting.
But as long as you reviewed the minutes, you can vote on them.
Before we move on, Joe, how many
I'm
people need a
okay.
printed copy of the minutes? Cause I
I
don't
don't see
want,
the downside to having them on the table, just like we've always done before. And I think that's what Heidi would prefer.
I don't need them, so.
I don't need it. Maybe just one or two copies.
Yeah.
One or two copies would
Yeah.
be great.
That's fine.
Yeah.
I just want to, I don't want to print out, we throw them out every week, so
Yeah.
it's a waste of paper. So if somebody needs them, I'm more than happy to provide it, but if we can reduce the waste, that would be great.
Save a tree.
That's
Yeah.
right.
It does make more sense to read them before we gather, to think about.
Yeah, right.
Okay,
Thanks, Joe.
nope, it's fine with me, Joyce. All right, I've got them in front of me anyway, so at any rate, okay, let's move on. Joyce, health agents report?
Yeah, there's not much to report, obviously, given the snow, we're not doing any septics at the moment. So-
Wonder why.
It's been kind of slow in that department, where permitting, all the major permitting for the beginning of the year is done. We do have an upcoming, group truck inspection that will occur at the end of March, through the Truck Association, which is great for us, because we go there one day, bang them all out, and it's done and over with. For the most part, we get pretty much everybody. Lori and I will be attending a housing court training next, when I get back, the 19th of March. So, Annie, the nurse, will be in the office because we won't be there. She will be covering the office, so there'll be somebody present in the office, for most of the day. She does go over to the COA to do the blood pressure stuff, for like an hour. So, but we've got that covered. We will be doing a CPR class towards the end of March, early April for the COA staff. We figured that was a great place for us to start, to get our feet wet with doing it. They're all recertifications. So we'll be doing that as well, so that we can make sure we hit our quota for the year. We'll be also doing a surf safe class this coming Monday. And then I also, so that's pretty much what I have for me. I'm still at part-time for at least another week or so. My plan, as long as I get the okay from the doctor, is to pretty much go back to full-time, once I get back. I'm gonna be out for a few days. But when I get back, hopefully be back up to full-time at this point, because this half-time's driving me nuts. So pending any major issues with the surgeon, I'll be good to go. I also have an update from the nurse, just to, some base, I had to write up basically just covering most of the stuff that she's accomplished in like 2 months, which has been phenomenal. So she's established weekly visits for the COA now. Every week she's there. We've really seen an uptick in people stopping by, getting their blood pressure done, talking.
That's great.
Her and I also met with Holly to discuss the best way to do med checks, like having people take pictures with their phones, write down information, so we can kind of keep a list in case there's an issue. Holly has some of that information, but we're kind of trying to come up with plans that make it easy for the residents to, if they need to have us check stuff out, meaning Annie, check out medications, she will. In addition to that, she has already reached out to, I put her in charge of the vaccination clinics.
Nice.
That's what she's there for, so.
Yeah.
She's already reached out to CVS. We've nailed down some potential dates in both early and mid-September and October. We're also going to be meeting with Sue Woodward from REC to set up possible vaccination days for kids' camps
Oh,
to
yeah.
get, make it accessible and easy for residents.
Yeah.
With the potential of also doing a flu clinic on a Saturday at either, say, the library or the rec, because it's open. So that's in the works. So she's been great about just, I'm telling you, give her a task and she's on it.
Great.
She's completed the vaccine education webinar series, respiratory illness, season immunization challenges, TB expert network meeting, level 1 TB basics contact investigation, latent TB infection, through the Curry International Tuberculosis Center. She also did the Tuesday webinar series with the Department of Public Health. I mean, it's just like a question and answer session. She can go on, ask questions, get information. She's also done a webinar series for Maven users with a lot of electronic case reporting and Maven updates. She's completed an online portion of the instructor for the BLS course, and she's going on a Sunday. We're sending her so she could be an instructor. That way, all 3 of us in the department are certified. So any combination of us or all 3 can do it. She's also completed foundations of local health through Mass Train, which is sort of the public health. Department of Public Health really wants all of us to have completed these core courses. So she's completed, let's see, local health practice in MA, public health 101, HIPAA trainings, multiple public health and nursing related classes. She's also doing Maven cases, acknowledging and tracking. So we've had no issues with that. We do have extra coverage through the epidemiologist of the grant if we need it. Some things that they've been tracking, obviously flu, COVID, Lyme disease, hepatitis. Investigations have been done for shigellosis, human granulocytic anaplasmosis. Sorry, I can't look at a word and say it. Giarditis. And she's also created pivot charts to compare data. She's working on the MIIS access granted, training completed, and she's created, I have it on the back for flu stuff information. For COVID cases, December 18th through the 17th, there were 5. COVID cases were reported on December 18th, January 17th, February 5th. Flu cases, in December, we had 49. We had 25 in January and 19 reported in February for the flu cases. So I told you about that. She does weekly meetings. Yeah.
Can you make sure she's keeping an eye on measles?
Yep.
Because we're starting to see measles
Yeah,
pop
we
back
haven't
up.
had any active cases. here, but, we're aware of the 2 cases that were, announced through DPH in the state.
Yeah.
And those where they were, but they're not.
They didn't tell us where they were.
Yeah,
They're not downtown.
right.
I'm not getting notifications, but she is obviously keeping an eye on that.
Yeah.
Right.
As well. She also does weekly meetings through the grant. The grant has a public health nurse specialty person. So she's doing that. She's also met with 13 volunteers. In case we need, help for anything that, this is a group, I guess, that Janet was involved with. And so, she met with 2 of the people, the main head people, so that like if we have a flu clinic and we need some extra hands, as long as we give notice, they're willing to come and help out. So,
Right.
she's done really great with a lot of outreach and, that. So she did give me 2 graphs. She's, very proud of herself because she was there. She's really funny about it. But as far as December goes, number of SARS was at, looks like 19. Summer flu was at 52. SARS for January 17, 25 for flu, February 5 and 20.
Yeah, we're seeing a lot of RSV. too.
Yeah.
I was gonna say that.
And then,
yeah.
Vaccination coverage, for the 25-26 flu season, she looked at, I know she's pulling the data off the MIIS, I believe.
Yeah.
So females, were at, for no doses in females was at about a little under 180. And for 1 or more doses was only at about 65. And for men, no dose was at about 170 and in about 65 for 1 or more doses for people vaccinated, according to MIS.
That's for COVID or is that for flu?
It just says,
Vaccination.
flu vaccination season. It doesn't tell me,
Okay.
it doesn't differentiate. So that's the information that she could get.
Okay.
And we're still advising people get a vaccination, flu vaccination,
No, we do not.
We are advising them to,
Talk to the doctor.
We're providing
Okay.
access.
No, I just want you guys to know that that's what we, as the department.
as a
say.
department,
get a call.
we say, follow up with your primary care.
Right.
Yeah.
And as a board, we have said that we will follow the Mass DPH suggestion.
Right.
Right.
Yeah, whenever somebody calls us,
Mm-hmm.
that's exactly what we say. So that we can't tell people, I don't know what their medical history is. I'm not a doctor.
Right.
Yeah.
And it's beyond our scope.
Right, but I do want
Yeah.
people to know that.
Yeah.
Obviously, we support the vaccination and we're providing vaccines.
Yeah.
And we do tell them that we'll have them in the, that we have them in the works so that they will be available.
If they decide to,
Yeah,
after speaking with their
Yeah.
doctor. Perfect.
so that's pretty much it for me.
So Joy, so the numbers that you quoted, like 65, is that 65 per 1,000 residents, or what is that 65 mean?
It just,
Any of those numbers?
that's it. I'm telling you what I got.
Yeah, okay.
So
Okay.
I
It's the beginning of our
Okay.
stuff. I'm sure we're gonna get more specific stuff as
Yeah.
we move along.
was trying to just give me some updates.
Yeah, okay.
Sounds like she started off with a bang.
Yeah.
Like she's
Yeah.
accomplished more in
Right.
2 months.
Right.
Great.
So
She's doing a wonderful job.
yes, and she's shows up on time or early. She is more than happy to accommodate if we need to switch a schedule. She's definitely a team player, which is, it's just been lovely.
That's great.
Yeah, it's because Pat's shoes were hard to fill.
That sounds like Annie's a really nice fit.
Oh, absolutely.
Wonderful.
Both Lori and I feel like this is a good, it's been great for the department, so.
Great. Awesome.
Yeah,
Excellent.
Okay.
that's it for me,
Anybody
Joe.
have any other questions for Joyce?
I
Okay,
think we're good.
Oh, so I did
Okay.
have one other thought.
I-
With the recent snow and whatnot, did we hear of anyone who was having housing issues during the storm or?
No, if anybody
Okay.
calls us for those kinds of
Yeah.
resources,
Right.
we give them a list that we have. We also tell them to get in touch with Plymouth area coalition for the homeless, because that's really all we can do.
Right.
I do not have access to
Mhm.
programming or like, there is nowhere to send somebody other than that
Right.
agency.
Right. But as far as you know, this department didn't get any calls like that. You would know that, okay?
No.
Yeah, just one.
No, we haven't got
anything.
we got somebody from the school calling us today, with a long list of requests. We don't know who, like, we don't know what department they were calling from, but we gave them what we had. So it sounded like it was, I think it was from admin, right? The
Yeah, when I
administrative
looked up
office.
her name, it was, I think the special education, area. She was just looking, I think she knows a family that needed some, support.
Direction.
So she was looking for
I'm kind of surprised that it was
regional
reached out to-
liaison or.
Yeah.
Yeah, we kind of lucked out in this last storm. The loss of power was, I had anticipated it was gonna be weeks, and it was day, I was out 4 days.
I wasn't out at all.
Me either.
I wish I was shocked.
Yeah,
Oh,
yeah.
I was out for 5 days.
So,
But the warming centers were open and other.
Yeah.
Yeah.
Yeah, okay, and I know the National Guard
Yeah.
came in, so,
Yeah.
yeah, all good. Okay.
Yeah, and just so you know, I'm in communication with Mark Douglas around that stuff, but really the
Okay.
fire department handles all that stuff. We, as this department, don't.
Right, okay, yeah.
If he needs me, he's made this clear. If he
Yeah.
needs me, he will call me, and
Okay.
he knows I will come in if he
Uh-huh.
needs assistance,
Right.
but they have it so well planned out and organized. Like, I mind my business unless I'm requested.
Mhm. Yeah.
They seem to have protocols in place, and, I don't think I need to muddy their waters, so
Mhm.
I just, if they need me, they will call me.
Okay, well,
Okay.
And you
The
said the
message we've been trying to
CPR,
put out-
I'm sorry.
the
That
message we've
CPR
been
course.
trying to put out, both as a board and through the senior center for years, has been for people to pay attention to their neighbors, especially their older people, their older neighbors,
Yes.
and
Mm.
be aware of it, what's
Yeah.
going on with them.
Right.
Yeah, we've been saying that at every opportunity we've had to address those at the senior center. Okay, just to report for you guys to the board, I had a long talk with the chairman of the recycling committee today. They're working diligently on a new presentation. They're reconsidering pay as you throw, which is one way that they're going to try to cut down on some of the trash that's going out of the community to get some of the costs down. And they're going to put up all those signage up at the transfer station to designate what should be going in, what bins. From what I understand, there's been a little confusion up there. Those are the
And
main
I find
things.
that the rules change on a weekly basis, Joe.
Well, what
We're not
there was an
getting in.
explanation to that now, just if you let me just, I'm getting a little older here. The explanation is that the parameters change. In other words, 1 week hypothetically, plastics may be a hot item. The next week, the vendors don't want any. The week after that, they want cardboard, then they don't want cardboard.
Or they want
Then
only
we can-
brown cardboard
Yeah.
and they don't want
With
printed
no
cardboard.
writing on it.
And
Really?
Yes,
Wait,
and
I
it's
don't
not so
understand.
much it's not so much us, that being the recycling committee or the DPW people. It's the vendors that we sell the materials to
Fine.
that keep changing the game. And
Oh, I
so-
totally appreciate that. It's just hard as a resident to make sure you're putting stuff where it goes when the
That's what we
rules
talked
are
about.
so
Yeah.
fluid.
That's why they're gonna they want to come up with some new signage that they can change on a regular basis as conditions change.
Well, that would be
as
good.
the markets change. So that's
Doesn't
what's
help me
going
with my
on that.
sorting at home though.
Right.
Yeah, they're really looking at streamlining that operation up there. And that's pretty much all I got on that. And I would have a question. Does anybody know what's going on with Healthy Kingston? We heard anything from Janet?
She fills us in, you know, she'll call and request, and then we give her tidbits of things to post, like, what do we give her, this,
Serve safe and I think we may have had her mention it.
Yeah.
yeah, we just give her updates of like things that are going on in the department, to talk about, you know, and announce on her show, but we haven't had to be on it in a bit She's had plenty of guests apparently.
We were supposed to be on
Right.
this past week. I had to cancel. Did you end up?
And then local scene canceled
Because of the
because
snow.
they were still closed. So she's
Okay.
gonna reschedule that to
Okay.
like the end of April. But I
Okay.
do know Janet has, a hospice nurse who's, no, hospice and palliative care. So someone will be coming on to explain the difference in both hospice and palliative care.
Okay.
Yeah.
All right.
And just on another note, nobody's mentioned this, but I hear about it down here all the time. Measles.
Yeah.
I just
Measles.
brought up measles, Joe.
No, needles.
Needles or measles?
Measles.
He's saying measles.
She's saying measles.
Like needles.
Measles.
MEA, right?
Yeah, measles, MEA, yes, measles.
Yeah, we
Yeah.
talked about it.
We
Joe.
talked about that,
The
Joe.
news.
Yeah,
Okay,
well,
it's all
because
over the news
there's
then.
outbreaks because we have unvaccinated people and we're gonna see
Yeah.
it,
More and
it's
more.
gonna happen.
I'm surprised it hasn't been more.
I know.
Not even wood.
Right. Well, what's gonna prevent it from being more, if not this year,
Right.
then the next year, the year after? And I think, Joe, you're asking, are we considering like what would happen if there was a big outbreak in town? Is that what you're asking?
Well, I'm hearing it down here. It's on the news every morning.
Right, yeah. Yeah.
Well, measles is highly infectious.
Highly infectious, we rely on herd immunity for it, and where people are choosing not to vaccinate children,
The herd.
it's putting
The herd of.
the immune compromised
Yeah.
citizens at risk.
Now, the latest data I looked at shows that Massachusetts still has a very high, 97% of school-age children have been fully vaccinated.
That's
And
good.
that's
So-
good.
Yeah,
Right.
yeah, but it still leaves other people
Right.
vulnerable.
Sure.
It's not always 100%.
Right.
Right,
But if you're
But,
up
yeah.
in the 90s, I
Yeah.
mean, that is such a significant
right, right.
percentage that we should be okay.
Right.
It's hard when you go to some of these other states where their vaccination rate is not
Yeah,
as strong.
yeah.
And that's where you're gonna see these outbreaks, and they're gonna see,
And kids travel for vacation and stuff, is what you're saying, like when they leave the state and go somewhere else. Well, anybody, not kids.
well, no, because what it is we have such a high vaccination rate that we're protecting those vulnerable populations.
Right.
You know, whereas if you go to a state where their vaccination rate is maybe 50%, where you have so much of the population unvaccinated, you have a risk of these outbreaks. And, you know, we're gonna see things happen that might not be pretty, you know, and there are a lot of repercussions to measles,
Right.
to other diseases.
Yeah, I remember I got them as a kid. I grew up before the vaccinations. Got immune the old fashioned way, just got everything.
But Joe, getting back to your idea of like the plan, it would be the state Department of Public Health that would come up with the plan, right?
No, I
Yeah,
understand. I just wanted to bring it up for a little
I thought-
discussion, that's all.
I got you. Yeah,
Yeah,
okay.
Well,
he's just down in Florida where their vaccination rate is not so high, so they're talking about it a lot more. You know, we've got 2 cases in the state that we can talk about.
if I had to say,
Yeah,
is
yeah,
they
yeah.
did not
They didn't get it.
get it here.
Right,
No,
right, right.
again, our best weapon and tool is education, public education. And, you know, to encourage, you know, have the schools encourage, parents to have the children vaccinated.
well, that we have that, Dennis, so we don't
Yeah.
even have to have that conversation. If our vaccination rate of school-age children is 97%, like Rosemary just said, that's wonderful, because
Yeah.
basically the only children that are not being vaccinated are those who cannot be vaccinated.
whatever
At this
reason.
point, right.
Or,
Yeah.
whether it be medical, religious, or there's some other reason where you have such a high percentage,
Yeah.
you're protecting them by having everyone else vaccinated. It's really herd immunity working at its best.
Yeah.
Okay, anybody else have any discussion subjects that they'd like to bring up?
I just wanted to follow up on one thing, so we're not going over the
Mhm.
minutes again, I was looking at, that, septic system failure that you were gonna be looking into, did
Yeah.
anything come of that, is anything?
Well, I'm
concerning
there, I'm
or-
pulling documents, it's
Okay.
not so straightforward, I have to actually go through all the documents, see what was sent, who owned it, what was done. So, and the other thing is now I have no evidence of it. So basically I need to wait until I can send a letter saying, hey, we're aware that this failed and we do not have anything currently that says that anything was ever done. But in order, I need the snow to be off the ground so I can
Okay.
actually see what's going on.
Okay.
I have permission from a neighbor to go on their property. And I've also had discussions with conservation because it's near wetlands.
Right, right,
So,
okay.
yeah, if that progresses, I'll let you know, but I also, I need to do due diligence before I go
Sure.
sending
Right,
letters
sure,
willy-nilly.
Yeah,
Absolutely.
absolutely, yeah.
We don't need to,
Yeah.
yeah,
Right.
just want everything to be 100% correct
Right,
before we.
yeah, okay, okay.
Okay.
Anybody
there
else?
is-
Anything else?
If there's no other business to come before the board, I move we adjourn.
So,
One
So-
other thing, Dennis, before you do, our next,
Yeah.
next meeting is March 16th, our next scheduled meeting.
I will not be here, so you
Okay.
can have your meeting, that's fine, I just won't be here.
Okay.
It's up to you guys, I mean, fine or
Well,
not
we'll wait
fine.
to see what, we'll wait to see what comes up between now and then, but, at this
Right.
moment, that is our next.
Warrants and agenda.
scheduled Meeting date.
Okay,
so I do have one thing that I'd like the board to think about. And this was, so there's a grassroots group in town called Kingston Women Helping Kingston Women. And they're looking to put together a resource book of all the resources that we have in the town that people can be referred to. So, I thought, well, we've got the report that was done by the epidemiologist. So I sent that off to the two leaders. So it's Janet and Donna Apple. I don't know if you all know Jan. So they are sort of heading that up. But it was a group of women from like sort of all different departments. And so pulled that up. And then Janet, after reading it, asked me a few things. I said, you know what, I don't know. So remember we got it in June of 2025, but we never discussed it as a board that I was aware of. And there are some specific recommendations in there that don't quite make sense to me, and don't have the data I was looking for. Is that okay?
fine by me, what you're saying.
Yeah, okay. So one suggestion is to have the epidemiologist come and talk to us as a board, which she has done for other towns, like within this grant. Any thoughts on that? I would love to invite her to do
Why
that.
do I feel like she was here?
I don't know that she might have come one time, a long time.
Maybe
ago.
just an
First get
introduction.
hired. Yeah,
Okay.
yeah. You guys want to have her, we can set it up for the 16th.
Well,
See if
no,
she's
because.
available.
We'd have to ask her if she's
Well,
available.
I'll just
Why not?
tell
Yeah,
her,
right.
it's not an
No,
app.
we'll wait till we have everybody in
Okay.
attendance and then we'll
Okay.
Yeah.
to schedule something like that.
What?
What'd you say, Joe?
Wait until we have everyone in attendance. Didn't you just say you would not be here on the 16th, Joyce?
I don't need to be here for that.
I'm not saying you need to be
I-
there. I would just prefer that you are.
I've already heard it at the grant meeting.
Right, right. And the
Fine,
information
so
is.
you can hear
the
it again.
yeah,
I just
the
would prefer
information,
that
though.
you're there.
Don't want you here.
Yep, I got it.
Yeah, okay. But so the information is meant for the Board of Health, like it's Board of Health work as opposed.
I understand.
Yeah.
It's
as
for the
opposed to-
agent.
Prefer
it's-
to wait
right,
into April, a little better weather, and that Joyce would be able to attend it as well. That's all. Simple
Yeah,
enough.
you sent us all the information.
yeah, right.
That's fine.
Did you all also get the Safe 2.0 thing that I
Yes.
sent? All right, whether
Oh.
you do it or not, your business.
I did get that,
Yeah, you did. You responded to it.
the safe thing,
Yeah, it's Safe 2.0. It's the
Right.
MMA
right.
webinar, so you guys can know what it's about.
I thought it was exactly what we're supposed to do. I know we're supposed to take courses
Yeah.
on that thing, and on train, I know we're supposed to do that. I have no idea what the courses are, so that was my question. We still don't know. Okay.
Whatever they sent you,
Okay.
I was told to send it to you, I did it.
Did anyone see that? Like which courses we're supposed to do on train?
You could email them.
So I'm going to the, when is it?
I mean,
Yes. The
That-
20th, it's this month,
Yeah,
how much? I will ask that, yeah, okay. I
yeah.
will ask that, like,
Yeah.
what is it we're supposed to be doing? Because we're all supposed to be certified.
Is it the
Members of the
board members
Members
or
of the
the
board.
agent?
No,
They
I'm
have
already
separate-
got all that.
Yeah, separate
I
things.
did that like 6 months in.
Right. Board members have other obligations now, and I haven't seen what that is.
I didn't know they were obligations. I thought they were options.
No, my understanding is no, but I'll look into it.
I'll have to reread it.
Okay, we will revisit
Yeah.
this at our next meeting then.
Now, I don't know if you looked at any further. Was it the same things that were going on at that?
You know, it's the same basic titles, but a lot of things have happened in between then
I
and
feel like
now.
it's new information.
So I think it's gonna be new information, right? Right, it's gonna be current. People will be asking current questions,
Mhm.
you know, so.
Okay.
Anything else?
Be interesting.
Dennis?
Okay, if there is no further business to conduct, I make a motion to adjourn.
All right, just to be clear, are we meeting on, do we
Well,
have a second meeting in March now or no?
It's
We
the
have
way
one
you
March
want.
16th, if there is enough to meet for. If there is not enough
Or
to
we
meet
have
for, then we
canceled it.
will defer till the
Right.
following
Okay.
meeting.
Okay.
Thank you, Heidi. Does somebody want to second Dennis's motion?
I'll second, oh, Rosemary's got it.
All in favor?
Aye.
Aye.